And joining us now from his constituency, Antigonish, the town of Antigonish specifically, we're very pleased to be joined on Telile 24/7 today by Liberal leadership candidate Randy Delorey. Randy, thank you for making some time for us today.
Thanks for having me, Adam.
That's no trouble at all. So I want to begin by asking quite simply, we're in the home stretch of the Liberal leadership campaign, the virtual convention set up for February 5th and 6th. How do you personally feel about how things are going at this stage of the campaign? And how do you feel about your chances of victory on the first weekend of February?
I think it's going really, really well. I had a plan that I put in place from the very beginning. It was one that was focused on engagement through the fall and using that engagement with members and stakeholders across the province to inform my policy. That allowed me to build a really strong, robust policy in a number of areas like health, economy, environment, seniors. Was just rolled out today. And I think that's stronger because I took the time to do that consultation. And I think that's reflective in the feedback I've been getting from members. So I think it's going really, really well.
Can you tell me a little bit about the consultation aspect of it? Because obviously this is a COVID-19 campaign. We all know that. It's not the sort of place where you can go to big rallies or conventions and shake hands or even knock on doors. So how has it been for you? And what do you think you're taking away from this process as you've been finding new ways to reach out to Liberal delegates and to voters in general?
Yeah, so I think you're absolutely right. This is a campaign, a leadership campaign like no other. Although for me, it's the first one I've participated in, so it's what a leadership campaign is. But from those who've been around, obviously, it's a very different. Not as you've mentioned, not having big rallies and communities and so forth. But also the shift. We were in between waves. So earlier in October, when the campaign first started, we were able to get out to some communities and do some small, almost kitchen table type of conversations with small groups of Liberal members and stakeholders. But by the time we got into November, I saw the second wave starting. So I announced that I was going to go completely virtual by early mid-November, and I've been doing that ever since. So that shift to fully virtual, although we were doing hybrid earlier and only small group in person, the hybrid has pros and cons. You can never replace being in a room with someone. I think we all know that in our personal lives, in our professional lives, that physical contact, whether it's a handshake or a hug with someone you haven't seen in a while, that's been challenging throughout COVID in many areas, and it's no different here in politics. But on the other hand, it means I haven't had to spend as much time on the road. I could have a meeting with a group in Richmond or Ayrshire, and then right after I finish that video call, I could be meeting with people in Pubnico or Metagan down on the other end of the province, and I'm standing or sitting in the same room. So there are some advantages there, and I was able to reach, I think, more diverse people in that way. Anyone who wanted to connect with me directly had the opportunity. I scheduled meetings with every riding association. So I think it was fantastic that way. But again, it doesn't replace the personal in touch side of things.
Well, that being said, you did decide to run for specific reasons, and I'd like to hear them. Why did you choose now for your first crack at the Liberal leadership?
Well, I think the first thing is, we're at an unprecedented time. I have a unique line of sight on addressing the COVID pandemic. I was the health minister through the first wave and took the lessons we learned from that first wave to prepare our response for the second wave, which was about the time that I made the decision ultimately to step away from health so I could step up to put my name forward to be the leader of the Nova Scotia Liberal Party and ultimately Premier of Nova Scotia. And the reason fundamentally for that is, look, I've got a young family. I've got parents that are retired. So I'm your average Nova Scotian living in rural Nova Scotia, working in the city. I've got exposure to both. I see the value and the importance and the beauty of both our urban and rural lifestyles. And again, that same notion of having young children still in the school system and retired parents aging on that side of the equation. So I think I have that lens of what we need to do as a province, how important it is to provide the care for our aging population, but also prepare the province and leave it in better stead for our next generation. I think I have the experience and the vision to make that happen, and I'm doing it for my kids and everybody else's as well.
Your experience in the McNeil government includes 3 key portfolios: finance, health, and environment. Do you get the sense that your experiences here
will help you in the decision-making process should you become the Liberal leader next month?
There's no substitute for following evidence. Making informed evidence-based decisions in any area is absolutely critical. And whether that's a lesson I learned in these portfolios and the experience I have, or if it's just my natural background as an academic, having been a professor at St. FX University before I got into politics, it's a technique or an approach I've applied since I came in and started at Environment in 2013, and I've applied it throughout all of my portfolios, and it's worked well. Obviously, when the Premier looked around and said, who's going to tackle our structural deficit, he looked to me when he said, who's going to tackle our healthcare challenges, get us through COVID. It was me that he picked for those roles to guide us forward. So the learnings, again, nothing substitutes for listening to the best advice, having robust conversations, allowing people to disagree with your default position, because that's the way you ensure that you see the potential pitfalls and you can either change the course or at least you go into them with your eyes wide open.
I want to center on health for just a moment, and you've presided over the health department at one of the more difficult periods for that department in Nova Scotia history. Of course, we speak of COVID-19 to begin with, and the difficulties in terms of outbursts in the Halifax area, particularly in Northwood at the long-term care facility in Northwood back in the spring. By the same token, you have presided over the health department during some difficult transition periods for the McNeil government. I look in particular to the closure of 2 hospitals in the urban areas of the Cape Breton Regional Municipality and the reallocation of services for those hospitals to the Cape Breton Regional Healthcare Complex and some other healthcare complexes in the area. Trying to maintain emergency rooms being open across the province, still a difficult challenge. It's been a challenge for many governments of different stripes over the years. What in particular do you bring from having worked on this portfolio, the health portfolio? And for that matter, what do you say to people who have expressed concerns about how things have unfolded in these 2 particular areas of health?
Yeah, so when it comes to COVID, I think, again, where we're at, how we've performed nationally and globally. In fact, I was just reading an article this morning from Germany that was highlighting the success of Atlantic Canada and Nova Scotia that, I think referred to as New Zealand of North America, one of the safest places. I mean, that's consistent. I think New York Times highlighted us as well. We've been recognized internationally for how successful our approach has been. And it goes back to what I said earlier about what I know and my approach. It's following the evidence. It's listening to experts. It's bringing the feedback and experiences from caucus colleagues who represent individual communities from around the province. It's listening to those voices, hearing those concerns, and then bringing that to the table while we're hearing from experts with the recommendations. So when we look at our COVID response, again, I think our success is reflected in that. And I think we did obviously have a devastating outbreak at Northwood, and we dug in and I took a decisive action to give a directive to bring healthcare workers from other parts of the health system to respond to that circumstance. We got it under control as quickly as we could, and then initiated a review by an independent panelist to experts to tell us, how did we do? What could we have done better in light of the circumstances for what we didn't know and what we did know about COVID at the time? And we've taken actions and invested over $26 million to address those recommendations to improve the situation, not just at Northwood, but throughout all of our other long-term care facilities. And then on the other side, taking that advice from healthcare workers in Cape Breton, the same thing. We were being told and advised, this is the approach, the infrastructure at those sites that we're going to be phasing out of the healthcare system represented and were not viable to manage the future of healthcare in that region. And so the commitment was new healthcare facilities in those communities, providing a lot of experience. One of the more exciting ones is in New Waterford. When I mentioned my advocacy around community rural education initiatives, and again, it would have been back when the Richmond School was being closed, one of the things I advocated for was this notion of community hubs. Well, that's exactly what's being established in New Waterford, is a community hub school attached to long-term care facility as well as a health center. Really excited in the community. Now they understand what's being done and how we're going to deliver healthcare within the region.
Final question, and this is a short question that could have a long answer. We'll see. Would you call an election for 2021 if you do ascend to the Liberal leadership on the first weekend of February?
I don't know when an election will be called. Certainly, one I can assure Nova Scotians will be called within about 14 months. There must be one by the spring of 22. So there'll certainly be one in all likelihood in either the spring of 21, the fall of 21, or the spring of 22. But at this point, until I get into the seat, we'll have to make an evaluation. First and foremost, priority is COVID. We need to keep Nova Scotians safe, get the vaccine rolled out efficiently and effectively so that we can get our economy back on track and ensure that Nova Scotia businesses and Nova Scotians can continue to put food on the table, take care of their loved ones, and get our lives back to normal and grow this province and ensure that we have a province that everybody can take part of the bounty we have to offer.
All right. We have covered a lot of ground in a short time, and I appreciate you taking some time for me this morning. Did you want to add anything else about all of this just before we wrap up?
No, look, I just appreciate the opportunity to speak with you. I appreciate the questions, and I know that this is an election that is for Liberals that was open to Nova Scotians who wish to sign up as delegates, but that deadline has passed. So for all the delegates in your riding, I'd certainly appreciate their vote in February. And if they have any questions, they can reach out to me at votedelorey.com to learn more about my policy positions. And that goes for any Nova Scotian that's in your viewing audience. At votedelorey.com, under updates, you'll see all the policy positions that I'm advancing as a candidate for the Liberal leadership and Premier of Nova Scotia.
Well, we know that under your cabinet portfolios, you had a full plate, and you still have a full plate now as a Liberal leadership candidate and MLA for Antigonish. We appreciate you taking some time for us. Thank you so much, Randy Delorey, for joining us on Telile 24/7 today.
Thank you very much.
Randy Delorey is the Antigonish MLA, and he is running for the Liberal leadership. The leader will be chosen this coming February on the 5th and the 6th at a virtual convention to be held on that first weekend in February.